system. This is an overview of how the health system works in Australia, its components, and public versus private. So the Australian healthcare system is funded primarily by the government, but there is some private overlay. The chief funding element is Medicare, and the secondary one is private health insurance. The Australian healthcare system is governed by the Department of Health and Aged Care, and it's the Australian Health Practitioner Registration Agency, or APRA, is in charge of looking after all of the registrations for medical and healthcare practitioners to make sure that everyone is actually qualified. The Australian healthcare system is divided into two sections: the public system and the private system. Both overlap, but we're going to just look at each system individually for a moment. So the public system is funded primarily through Medicare and is mainly responsible for hospitals and primary health care. Primary health care is basically to be thought of as your general practitioner or your first port of call when you have illness or sickness. Sometimes this can be a public hospital because people will present to emergency if they have something wrong, but generally people go to their GPs first, and that's what we call primary care. For routine emergency situations, there are a couple of pathways to get care within the Australian healthcare system. The first one is to present to the emergency department at a public hospital, where you'll be seen by staff, evaluated and assessed, and you may get referred through to public services, or you may get referred back to GP depending on what's happening with you. For routine care, that is general health, you want to get some bloods done, you've got something that you're concerned about with your health, you will go to your primary care first or your general practitioner to get evaluated, order tests, get an assessments, get referrals, that type of thing. They can refer you to specialists both in the public and the private sector. So they can refer you to the public system, which are under the guise of the hospitals, where you can see public specialist consultants. Within primary care, there used to be a lot more bulk billing available, where you could go and see a general practitioner and be bulk billed to Medicare. Unfortunately, given the rates that the government has decided to rebate general practitioners, this is primarily now gone to a private market where GPs will actually charge a fee for their services that are more aligned with costs, and costs entail, running their practices, staff, infrastructure, all the things. And so generally patients will find themselves more out of pocket. So it is still covered by Medicare, you just won't get all of that back. Urgent care has been introduced as a stopgap for people who cannot afford to see a GP now that bulk billing is almost gone from the healthcare landscape. So an urgent care centre is somewhere where you would go so that you're not clogging up the emergency centres or emergency departments or emergency rooms, however you refer to it, with things that may not actually constitute an emergency. So if you need to see a specialist, which could be for a number of healthcare concerns, there are two ways, as I mentioned before. One is the in-hospital services, where you will be referred to a public hospital to go to, say, a urology department or an orthopedic department, and they will assess you, and there will be no fees for that at all. You would attend the emergency department of a public hospital if you actually have a life-threatening condition like a heart attack, you're bleeding, or you really don't know but you're having trouble with your basic functions. And urgent care is designed for if you're not sure that you're dying but you really need to see someone because something is wrong. Now, if we look at the private sector of the healthcare system for primary care, as mentioned in the public sector, the primary care or your general practitioner is now in a position where there are very few bulk billing clinics because of the rebate costs that are being offered by the Australian government. So more often than not, you'll need to pay something out of pocket, but you'll still be able to claim some of that back through Medicare. There are also another level to primary care in the private sector. There are specialist GPs. So a general practitioner may have a special interest in men's health or women's health or psychology or dermatology, skin cancers, these type of things. And because these GPs have a subspecialty and they become known for having this specialist skill, they can charge higher than normal market value. For example, a normal GP consultation just for a standard review is probably going to be around about $70 or $80. That seems to be around the average. But a GP who is providing a more private setting and has a cap on their patients and maybe more family oriented or what have you, they can charge anywhere from $150 to $300 for a consultation that their private patients gladly pay, but the patients will still only get a small fee back through Medicare for those type of consultations. So routine in the private sector, you will go and see a normal GP and discuss your concerns. Let's say it's for a gallbladder. You've had some pain with your gallbladder and things aren't working quite so well. So they will send you, or they will give you a referral for a private specialist to be evaluated with a view to possible surgery. A selection of consultants are actually surgeons, but not all consultants are surgeons. All doctors do their surgery bachelor as part of their qualifications. So if you get referred to a private specialist, those consultations are actually covered by Medicare at a higher rate than if you were seeing your primary care physician. However, they usually are well under what a private consultant will charge. For example, a Medicare rebate I think is about $70 for initial consult, give or take, and a private consultant will usually charge for an initial consultation anywhere from $250 right up to $800, and you'll still only get the flat rebate back. This is part of the private system that's in the Australian healthcare system at the moment. If you need to have surgery as a private patient, what will happen is the private consultant that you've been referred to will refer you to the private hospital for where they do their procedures. So the process is that just say you needed to have your gallbladder out and you've seen a gastroenterologist or the general surgeon and they've said, yep, look, let's just take this thing out. They will then schedule you onto one of their operating lists within a private hospital, and then the hospital will contact you about your admission and all that sort of stuff. This is just a broad overview. Every practice is slightly different. At this point, that's where your private health insurance kicks in for consultations with specialists. So from here, the hospital will do a fund check to see whether you are actually eligible for services with your level of private cover, and discuss with you whether there's an excess payable or whether you're ineligible or a million other things that may happen. So in the private sector, in an emergency, you do actually have options as well. Some private hospitals run their own private emergency rooms. These are fee for service generally, so you'll get there and they'll tell you this is not free. There will be a fee. It's usually around about $150, but it can be more depending on the hospital. But you will be told, like, as soon as you walk in the door, they give you a big warning and they say this is a fee for service. Emergency room consultations are generally not covered by your private health insurance. However, if they admit you into their emergency room as part of your patient journey, that can be covered by some funds, not all funds. It's a whole thing, but I'm just giving you an overview. The private hospitals have at their emergency departments have on-call private consultants available. So let's say you presented with appendix pain and it was quite severe, and the nurses and doctors on call in the emergency there have decided, look, this probably needs surgery. They can call their on-call surgeon, who would come in and give you an assessment and then send you through the pathway through the private hospital. That way, if you needed surgery, you'd either be scheduled for surgery, you may be admitted for emergency surgery. They have all of those facilities available. If you're referred to rooms, that means the private consultant who's come to see you has gone, listen, it's not life-threatening, you don't need surgery today, but I want to see you in my rooms. Then you'll normally have to make an appointment to go and see them privately. And even though you've seen them in the emergency room or at the emergency department of the private hospital, you'll still need to pay a fee for your consultation with the doctor in their rooms. So generally speaking, private health insurance covers in-hospital treatments within a private hospital. However, you can also elect to be a private patient in a public hospital. Where this can benefit you as a patient is you may be assured of a single bed, or only a 2-bed shared room. There's as many levels and things that can be covered as you can think of as at this point, but generally your private health insurance will cover your hospital inpatient stays, and your extras will cover allied health such as optometry, physiotherapy, psychology, all those things, but they are not covered just by your hospital cover. So Medicare is basically funded by taxes from everyone who earns over a certain amount. There's a percentage that's put on as the Medicare levy, and that's how Medicare is funded, and the funds are dispersed across fees for service, and then also through funding to the states out of the Department of Health's budget, which is outside of just the Medicare budget. Not all services within the health system or health services that are available are covered by Medicare. Dentistry, not covered by Medicare generally. However, there is provision for children to be seen for routine dental examinations, etc. If your doctor suggests a form of treatment, always just ask them whether that's covered by Medicare, because some are and some aren't. The private system is funded by private health fund memberships, and that is supplemented by the Australian government in the form of rebates. So the Australian government realises and understands that their public system is not going to be able to completely serve the population. So they are trying to encourage people to also have private insurance, so that the private system can take some of that load away from the public system and leave the public system for those who really cannot afford any private health insurance or have access to the private sector at all. Within those rebates, they are subject to age and income. So there was a push for people to get health insurance prior to 30, I think it was. That may have changed at the time of recording. And they were given a significant rebate against their premiums, and then your income as well. So I think it's around about 93 where you get a level of rebate, and then if you earn more, you get less of a rebate. And if you take out insurance over 30 or whatever that age is, you get a lifetime penalty on your premiums, which means your premiums from the health insurer will be higher than if you didn't take it out before you were 30. It's just a way to encourage people into the system as quickly as possible, which I will talk about in another video about why that's a good or a bad thing. In summary, the Australian healthcare industry is a public and private mix. Its chief funding is Medicare, which is used across the board in both public and private sectors, and within private hospital settings and your private health fund memberships. So every item that you have in a hospital will have part paid by Medicare and then the balance paid by your private health fund membership. The public health system is funded through public money, through taxation, and supported by private health insurance fund memberships, which allow more people to access more services. Hope you found this helpful. If you did, please consider subscribing. I will be doing more videos going into more depth about different sectors within the healthcare system and Medicare and lots more. Thanks.